Welcome back to The Explainer. Today, we're taking what looks like a dense anatomical map and turning it into, well, a user manual for your very own human abdomen. We usually just think of our midsection as our stomach or maybe our core, right? But biologically, it's an absolutely incredible, highly pressurized fortress. And getting a handle on how this fortress actually operates, it completely changes how you look at your own body. So let's jump right in with something we've all wondered about at some point. What is actually happening inside you when you feel that awful burn of acid reflux? Or, when someone gets a hernia? These definitely aren't just random ailments. They are literal mechanical and chemical failures happening within that fortress. But to understand the failures, we've got to understand the architecture first.
To make sense of it all, here is our roadmap for today. 1, we're mapping the abdominal wall. 2, looking at hernias, basically when that wall breaks. 3, the peritoneum, which is the inner wrapping. 4, the stomach and digestion. And finally, number 5, the small intestine.
All right, kicking things off with Section 1, mapping the abdominal wall, specifically the muscular shield. Now, this wall acts as a massive multi-layered shield. Just look at how the gastrointestinal viscera, all those absolutely vital organs, are packed against your skeleton. The skeleton gives you the rigid structure at the back and at the top with your ribs. But the front and the sides? That relies 100% on a muscular wall to contain all of those highly pressurized contents.
If we move from the outside in, we literally build this fortress wall step by step through 4 distinct, crazy powerful muscle layers. First up, you've got the external oblique on the surface, which pulls downward and inward. Right under that is the internal oblique, running perpendicular to give it this incredible cross-bracing strength, kind of like plywood. Deeper still is the transverse abdominal muscle. That one wraps right around you like a corset, compressing the abdomen. And finally, running straight down the center, we have the rectus abdominis. Yep, the famous six-pack muscle that flexes your trunk. Together, these 4 layers maintain an unbelievable amount of pressure.
Moving to Section 2, hernias. What happens when the wall breaks and we get structural failures? When we look at this anatomy from the inside out, paying special attention to the lower groin, the inguinal region, we find something called the inguinal triangle. Just because of how our muscles and ligaments naturally come together down there, this specific triangle is a built-in area of potential weakness. It's actually the most common spot where the muscular wall just gives way under all that pressure, allowing parts of the intestines to physically bulge through. Now, we really need to pause here for a second, because the medical gravity of what happens when that bulge goes wrong is huge. I am talking about a strangulated hernia. This is an absolute life-threatening surgical emergency. See, it's not just a physical bulge anymore. This is when the protruding intestine becomes so tightly trapped inside that muscle defect that its blood supply gets completely cut off. Without prompt relief, that tissue literally dies. It is a pretty stark reminder of the high stakes involved in our body's mechanical integrity. So it's absolutely crucial to understand the 2 main ways this lower wall fails. Let's compare them side by side. An indirect inguinal hernia is congenital. That means it's a defect present from birth, where a little fetal pathway called the processus vaginalis just never closed up properly. The hernia essentially follows that pre-existing tunnel. A direct inguinal hernia, though, is acquired later in life. This one punches straight through the weakened abdominal wall muscles, right in that inguinal triangle we just talked about. And that is usually just due to wear, tear, and heavy lifting over the years. But hey, hernias don't only happen down in the groin. Structural defects can also let fat or intestines breach the upper and central parts of our shield. For instance, epigastric hernias happen higher up, pushing right through the central tendinous line, the linea alba, just above your belly button. Then you have umbilical hernias, which pop out right at the navel. Those actually often stem from a failure of the midgut to return properly to the abdomen back when you were developing as a fetus.
All right, on to Section 3, the peritoneum, which acts as the inner wrapping, or nature's saran wrap.
Honestly, the best way to think of the peritoneum and its folds is like nature's incredibly complex living saran wrap. It's this serous membrane that lines the cavity and completely wraps around your organs. You've got the greater omentum, which literally hangs down like a thick, fatty apron over your intestines. Then there's the lesser omentum suspending the stomach right from the liver. And the mesentery proper acts sort of like a fan, suspending about 20 feet of small intestines so it doesn't just pool down into the bottom of your pelvis. But here is the coolest part. This wrapping isn't just structural. That greater omentum will actually stick to areas of inflammation inside you, actively wrapping itself around inflamed organs to fight off widespread infection. It's essentially a mobile, biological first responder.
And thank goodness it is a first responder, because when the sterile inner sanctum of this wrapping gets breached, you get peritonitis. Say an ulcer perforates your stomach, or your appendix burst. Suddenly, highly infectious material starts leaking straight into the peritoneal cavity.
This triggers a massive, intensely painful internal crisis. It requires immediate medical intervention, heavy-duty antibiotics, and quite often, surgical washing of the entire cavity to literally clean it out.
Let's dive deeper with Section 4, the stomach and digestion. Time to look at the chemical arsenal. So your stomach is highly pressurized, and it's absolutely filled with acid. The only thing keeping that acid from shooting straight back up into your chest is a tight circular band of muscle called the lower esophageal sphincter. When that vital upper gate relaxes when it definitely shouldn't, or if it just weakens over time, that acid escapes upward. And that mechanical failure, that results in the painful everyday condition we all know as GERD, or chronic heartburn. Now, once food safely makes it inside the stomach, it goes up against a terrifyingly efficient chemical arsenal. First, gastrin stimulates the whole environment. Then, hydrochloric acid floods in to destroy invading organisms and severely drop the pH. That highly acidic environment allows the enzyme pepsin to activate, which starts shredding proteins into polypeptides. But here is the really brilliant part. To keep from literally digesting itself, the stomach constantly secretes a thick, protective layer of mucus. It is an incredibly delicate, high-stakes balancing act between absolute destruction and vital protection.
But when that delicate chemical balance fails, the defensive shield drops. And we now know this usually isn't just caused by stress or eating too much spicy food. No, it's most commonly triggered by an invading, totally acid-resistant bacteria called Helicobacter pylori. This bacteria actually disrupts that protective mucus layer, allowing the stomach's very own acid and pepsin to burn an agonizing hole or erosion right into the stomach or the duodenal lining. We call this a peptic ulcer. And it is no joke. It can actually erode straight into an artery and cause fatal internal bleeding. Moving into our final stretch, Section 5, the small intestine and the path of digestion.
We can actually map out the physical journey of your food sequentially. It enters via the esophagus, gets processed in the 4 distinct regions of the stomach, and then it's carefully metered out of the pylorus, right into the duodenum for some intense mixing. From there, it enters the jejunum, which, by the way, is where the vast majority of your nutrient absorption happens, and finishes its transit through the long ileum. We are moving from simple mechanical transport into staggeringly complex chemical absorption here. Let's zoom in on that very first segment, the duodenum. It's the shortest, widest part of the small intestine, forming a little C shape that perfectly hugs the head of the pancreas. Honestly, think of it as the ultimate mixing bowl. It takes the highly acidic processed food from the stomach and simultaneously receives a potent cocktail of bile from the liver and powerful enzymes from the pancreas. All of this mixes together to neutralize that stomach acid and break down tough fats and proteins.
Unfortunately, inflammatory bowel diseases can relentlessly attack this intricate system. Take Crohn's disease, for example. It can happen anywhere in the GI tract, but it most commonly targets the ileum, that final section of the small intestine, causing severe inflammation and weight loss. Ulcerative colitis, on the other hand, strictly involves the lower tract, so the colon and the rectum, causing incredibly painful ulcers right in the mucosal lining.
And because this small intestine system is essentially a 20-foot-long, continuously coiled tube just suspended inside your abdomen, it is wildly vulnerable to physical blockages. We're talking postoperative scar tissue, tumors, twisting of the bowel, which is called a volvulus, or even one part of the intestine weirdly telescoping into itself. Any of these can completely block that tube. A strangulated obstruction like this is a dire emergency. If that blood supply gets cut off, the tissue can quickly become necrotic, meaning it dies. Definitely not something to mess around with. Before we wrap, I have to leave you with one of the most fascinating anatomical quirks in this entire region. Roughly 2% of the human population carries around a hidden secret called Meckel's diverticulum. It is a tiny, finger-like pouch just sticking off the ileum. And what is it exactly? Well, it's literally a leftover remnant of your embryonic yolk stalk. It's a piece of anatomy from back when you were a developing fetus that just never went away. In some wild cases, it can even contain ectopic stomach tissue that secretes acid and causes severe internal bleeding completely out of nowhere. Which brings us to our final thought. As we finish up this explainer, I want you to truly think about this. The delicate balance of high-pressure muscular walls, powerful corrosive acids, and 20 feet of coiled intestines makes our abdomen a true masterpiece of biological engineering. But with so many intricate moving parts, are our bodies miraculously tough, or are they actually startlingly fragile? I think the truth is, it's a brilliant, breathtaking mix of both. Thanks for joining me today and keep exploring.